Welcome to the Department of Health's online information modules for the National Aged Care Mandatory Quality Indicator Program, also known as the QI program, for residential aged care services. This module is part of a suite of resources available to help services understand and meet their obligations under the mandatory QI program. During this session, we will take a closer look at the third quality indicator, or QI, unplanned weight loss. We will discuss the why, what and how of collecting and submitting data for the unplanned weight loss QI. We will also touch on QI reporting and how to use service-level reports to track progress and inform continuous quality improvement. By the end of this session, you should have an understanding of the objectives of the QI program, unplanned weight loss and some of the reasons it may occur, the importance of monitoring unplanned weight loss, QI program requirements for the classification, data collection and reporting of the unplanned weight loss QI, and where to find further information about the QI program. So what is the QI program? From 1 July 2019, participation in the QI program became a requirement for all government-subsidised residential aged care services. It is now mandatory for residential aged care services, including respite services, to submit QI data to the Department of Health every 3 months. The following programs are currently excluded from the QI program: flexible care, including transition care, the short-term restorative care program, multi-purpose services program, the National Aboriginal and Torres Strait Islander Flexible Aged Care Program, the Innovative Care Program. The objectives of the QI program are for providers to have robust, valid data to measure and monitor their performance and support continuous quality improvement, and, over time, to give care recipients transparent, comparable information about quality in aged care to aid decision-making. The QI program may benefit your service by providing a set of meaningful and measurable QIs to assist your service to monitor and improve important aspects of care, enabling your service to monitor and identify trends in performance over time, compare with other services, and implement improvements that will promote quality of care and quality of life, and, over time, through the publication of information about the QIs, the QI program may enhance community understanding of the high-quality care your service provides and assist care recipients with choices and decision-making about their care. The QI program involves specific methods for collecting, recording, submitting and interpreting information about the QIs. It is important for the reliability of the QI program that your service uses the methods exactly as prescribed in the QI program manual. The QI program currently includes 3 QIs that address important aspects of quality of care in clinical areas. These are pressure injuries, use of physical restraint and unplanned weight loss. Each indicator has categories for which data is collected through assessments and measurements. Data needs to be collected for a total of 10 categories across the 3 QIs. We will explore each of these categories in further detail as we look at each of the QIs. Let's take a deeper look at the third quality indicator, unplanned weight loss. For the purpose of the QI program, unplanned weight loss is defined as weight loss where there is no written strategy and ongoing record relating to planned weight loss for the individual care recipient. There is substantial evidence and research that the prevalence of unplanned weight loss is significant among older people living in residential care services, with studies showing that up to 31% for those over 65 years of age in long-term care experience unplanned weight loss. So why does unplanned weight loss occur? Unplanned weight loss in older people is a highly complex and multifaceted health concern that can involve social, environmental, emotional, psychiatric and physiological issues, including behaviours linked to dementia. There are a number of reasons why unplanned weight loss may occur in older people living in residential care services. We will explore some of those now, noting this is not an exhaustive list. The presence of pain, illness and chronic, malignant and neurological disease can all contribute to weight changes in older people. Research also suggests links between the presence of dementia and weight loss. Some of the behavioural and other characteristics of dementia that may result in unplanned weight loss include pacing and wandering, resulting in untreated increased caloric intake needs, inability to self-feed, no longer knowing how to eat, apraxia, decline in communication skills, inability to recognise food as food, agnosia, paranoia and mistrust regarding food, forgetting to eat. There is also a correlation between unplanned weight loss in older people and polypharmacy, medication side effects and interactions. Depression and other psychological factors can also cause unplanned weight loss. Another concept explored in the literature is unplanned weight loss relating to physiological age-related changes. While weight loss and malnutrition are not inevitable consequences of ageing, the physiological changes that occur in older adults can increase risk. These changes include decreased sense of taste and smell, changes to dentition, that is, loss or damage of teeth, poorly fitting dentures, poor oral health, feeling fuller quicker, reduced appetite, changes in the gastrointestinal tract that lead to poor nutrient absorption, reduction in cellular capacity to store water, increased frailty, swallowing difficulties, reduced eyesight. Issues relating to the eating environment and staffing, as well as to the quality of and access to food choices that meet care recipients' cultural, religious, and personal food preferences should also be considered. Unplanned weight loss should not be dismissed as a natural age-related change. Many causes of weight loss can be addressed if detected early. All members of the care team play an important role in screening care recipients at risk and ensuring they receive adequate nutritional care. Any care recipient identified as having or at risk of having unplanned weight loss in screening should be referred, according to service policies, to their GP and/or dietitian. A number of adverse events may occur as a result of unplanned weight loss in older people and have a significant impact on quality of life. Unplanned weight loss can lead to an increased risk of loss of bone density, falls and fractures, particularly hip fractures, developing pressure injuries, poor wound healing, loss of strength and mobility, malnutrition and death. So what exactly are we measuring for the QI program? There are two measures for the unplanned weight loss QI. These are significant unplanned weight loss and consecutive unplanned weight loss. Significant unplanned weight loss is defined as unplanned weight loss equal to or greater than 3 kilograms over a 3-month period. The significant weight loss measure is determined by comparing the care recipient's weight at the final weigh this quarter with their weight at the final weigh of last quarter. Where the result is a weight loss of 3 or more kilograms, the significant unplanned weight loss measure is recorded. Consecutive unplanned weight loss is defined as unplanned weight loss of any amount every month over 3 consecutive months in the quarter. This can only be determined if the care recipient has a recorded weight at the final weigh of the last quarter and is weighed on all 3 occasions in the current quarter. All care recipients must be assessed for unplanned weight loss except for care recipients who are absent, for example in hospital, care recipients receiving end-of-life palliative care, respite care recipients. To get the most accurate information possible, it's important that everyone collecting the data does this based on the classifications, measurements, and assessments prescribed for each QI. This information is contained in the National Aged Care Mandatory Quality Indicator Program Manual, which is available on the Department of Health's website. The QI Program Manual supports a consistent approach that allows services to compare results across collection quarters with other services, as well as against national averages, by prescribing methods for classification, data collection, and reporting of the QIs. Information from existing data sets, for example incident reporting systems, must not be used where information has been collected differently to QI program requirements. For the unplanned weight loss QI, each care recipient must be weighed on or around the same time and day each month for each QI program quarter, which equates to 3 times each quarter. This QI also uses the care recipient's last weight from the previous quarter. Remember, You don't need to weigh all care recipients on a single day in the month. You can weigh a number of people each day, providing this is on or around the same time and day each month on a calibrated weighing device. For example, if the service has 20 care recipients, you may wish to weigh 10 care recipients in the first week of each month and the remaining 10 care recipients in the second week of each month. As with all aspects of general care, consent is a requirement, and the QI program is no exception. Care recipients must provide permission to allow their weight to be taken and for their data to be included in the QI program. There will be care recipients who do not wish to participate. These care recipients will not be counted in the total number of care recipients assessed figure for your service. Regardless of whether or not a care recipient is included for reporting purposes, any unplanned or unexpected weight loss should be investigated promptly and appropriate treatment commenced. If a care recipient cannot be weighed, it is still good practice to monitor them using alternative means such as mid-arm or calf circumference or malnutrition screening. This ensures changes are identified and appropriate strategies put in place. Now let's take a look at a few scenarios. The next part of this information module is an example data collection cycle. We will work through a couple of scenarios, recording the results on the data collection sheet and preparing the data for upload into the My Aged Care Provider portal. Okay, let's meet our care recipients. You work at the ABC 123 Residential Aged Care Service, where you look after 6 care recipients. You have chosen to split your care recipients' weight assessments into 2 groups. The first group of 3 care recipients will be weighed on the first Monday of each month, just before breakfast. The second group of 3 care recipients will be weighed on the second Monday of each month, just before breakfast. For this example, we will utilise the data collection sheets. You can find templates for these on pages 71 and 72 of the QI Program Manual. Meet Mr. Seth. Mr. Seth's weight at the final weigh of last quarter was 83.5 kilograms. His weight at the first weigh for this quarter was 83.3 kilograms, a weight loss of 0.2 kilograms. In the second weigh for this quarter, he recorded 82.9 kilograms, a loss of 0.4 kilograms. For the final weigh of the quarter, his weight was 83.2 kilograms, a gain of 0.3 kilograms. Overall, Mr. Seth had a total weight loss of 0.3 kilograms for the quarter. As Mr. Seth lost less than 3 kilograms for the quarter, he does not meet the definition for significant unplanned weight loss. Mr. Seth also does not meet the definition for consecutive weight loss, as he did not lose weight in each of the 3 months in the quarter. On your data recording sheet, you record this as no for both measures. Mrs. Jaya joined us at ABC 123 at the start of the current quarter, and so she does not have a carryover weight, so you record the weight at the last weigh as null. Her weight at the first weigh for the quarter is 60 kilograms, with null for change of weight from the last month. The following 2 months, she was weighed at 58 kilograms and 56 kilograms respectively, for a loss of 2 kilograms for each of the 2 months, and a total weight loss of 4 kilograms. Because Mrs. Jaya does not have a weight at final weigh from the previous quarter, she can't be counted under either of the unplanned weight loss QI definitions. That is, we don't know if she gained or lost weight in the first month of the quarter, and we also can't compare her weight at the end of the current quarter with her weight at the end of the previous quarter. Although Mrs. Jaya will not be counted under the QI definitions for unplanned weight loss, it is still important to have her weight monitored as she is rapidly losing weight. You decide to refer Mrs. Jaya to the registered nurse to further investigate the cause of the weight loss. You include a comment on the recording sheet that states, "Entered service in July, as such was not included under the QI program definitions, but has significant unplanned weight loss that is being investigated." Even though Mrs. Jaya couldn't be counted for this quarter under the QI program definitions, it is important that her weight at the end of the quarter is recorded to ensure she can be counted for the following quarter. Now for Miss Brown. Miss Brown has a weight from the final weigh last quarter and was present for all 3 months for the current quarter. Miss Brown's weight at the final weigh from last quarter was 82.4 kilograms. Her weight at the first weigh this quarter was 80.4 kilograms, a weight loss of 2 kilograms. Her weight at the second weigh this quarter is recorded as 78.8 kilograms, indicating a loss of 0.6 kilograms. Her weight at the third weigh this quarter was 78.2 kilograms for a loss of 0.6 kilograms. Reviewing her data, we can see she has a total loss of over 3 kilograms, and she has also lost weight for all 3 consecutive months of the current quarter. As such, we record her as yes for both significant unplanned weight loss and consecutive unplanned weight loss. You also refer Miss Brown to the registered nurse for further investigation of her weight loss. As Miss Brown was the final care recipient for the group, you now total up the sheet and summarise the comments for ease of transfer to the My Aged Care Provider portal at the end of quarter. Now let's meet our second group of care recipients. Mr. Maith is our fourth care recipient and was present for all 3 weight assessments. His weight has been relatively stable. Mr. Maith's weight at the final weigh last quarter was 85 kilograms. His first weight for this quarter was 86 kilograms for a gain of 1 kilogram. In the second weigh this quarter, he recorded 85 kilograms for a loss of 1 kilogram, and 84 kilograms for a loss of 1 kilogram in the third and final weigh this quarter. His total weight loss for the quarter was 1 kilogram. As he has not met either quality indicator measure definitions, significant unplanned weight loss or consecutive unplanned weight loss, you record no for both measures. Our fifth care recipient, Ms. Toulis, was present for the first 2 weight assessments, but missed the third weight assessment as she was admitted to hospital at this time. Ms. Toulis's weight at final weigh last quarter was 65 kilograms. She lost 0.5 kilograms in the first weigh this quarter and another 3 kilograms in the second weigh this quarter. During the third month of this quarter, she was hospitalised during the scheduled weight assessment period. You note that Ms. Toulis lost more than 3 kilograms for the quarter, but as she was not available for the final weight assessment, she cannot meet the QI program's definitions and must be excluded from the QI program counts. You mark this as null and add a comment identifying why she wasn't present for the third weigh. In this scenario, although Ms. Toulis will not be counted under the QI program definitions, in her case it is still important to have her weight monitored as she is rapidly losing weight. You refer Ms. Toulis to the registered nurse to further investigate the cause of the weight loss. When asked to consent to have his weight assessed, Mr. Fraser adamantly refuses and will not give his consent to be weighed on each occasion. You include Mr. Fraser for completeness of your records and record null values for each weight and QI measure. You record in the comments that he did not provide consent. Now, in the same way as for Group 1, you summarise the comments for Group 2 and tally the total for each measure. That ends Group 2 and the unplanned weight loss data collection for this quarter. Next, let's look at the data summary for the quarter. To finalise this period of data collection, you must complete the summary data sheet in order to prepare the data for entry into the QI part of the My Aged Care Provider portal. It is at this point you must compile the following information. 1. The number of care recipients whose weight was monitored. 2. The number of care recipients who experienced significant unplanned weight loss. 3. The number of care recipients who experienced consecutive unplanned weight loss. 4. Any related comments including A. Explanation of any difference between the total number of care recipients and the number of care recipients whose weight was monitored/reported. For example, care recipients who died, care recipients who were in hospital for 1 or more of the weighs, care recipients new to the service who do not have their weight recorded for all weighs over the quarter or the final weigh of the previous quarter, care recipients who chose not to participate in the monitoring. B. Noting the number of care recipients who were included in both measures, that is, the number of care recipients who lost 3 kilograms or more over the 3 months and lost weight every month for the 3 months. C. Any other comments relating to significant or consecutive unplanned weight loss. Example data recording and summary sheets can be found on pages 71 and 72 of the QI Program Manual. It is important to note here that the comments you upload into the portal are displayed on your QI reports. Do not include any personal information in any of the data you submit to the department. This includes information such as care recipient names, initials, or bed numbers. You should now review the summary sheet, and when you are ready, click Next to view the data submission page in the My Aged Care Provider portal. Data needs to be transferred from the data summary sheet into the My Aged Care Provider portal. All users can enter QI data, however, only your services administrator can submit the data. If you are not the administrator, you can save and finalise the data, then workflow this to your services administrator to submit the data for the quarter. It is important to note that all data must be finalised and submitted each quarter prior to the submission deadline, which is 21 days after the end of each quarter. Your My Aged Care Outlet Administrator is responsible for submitting your QI data via the My Aged Care Provider portal. As you can see, using a summary data sheet that mimics the design of the My Aged Care submission screen will make the data submission process easier. If you are the My Aged Care Outlet Administrator and you would like to find out more about how to set up and use QIs within the My Aged Care system, please refer to the Quick Reference Guides or QI Program Manual, which are available on the Department's Quality Indicators webpage. 3 service level reports will be available via the provider portal. These will become available 7 days after the data submission due date for the quarter. The reports include a Quarterly Facility Summary Report, Quarterly Facility Detailed Report, QI Report graphical displays. Any staff member or team lead can run these reports once their My Aged Care Outlet Administrator has enabled their QI role. These reports will provide a summary of your data and allow you to track progress over time. Service level reports can be used to track quality indicator data over time and identify areas for quality improvement. Multidisciplinary teams are encouraged to consider this data and any factors corresponding to increased or decreased prevalence rates. For example, a service has noticed a consistent trend relating to the proportion of care recipients experiencing unplanned weight loss. While the data reported locally is similar to the national average on the QI report, they would like to reduce it further. The service consults with a dietitian to introduce a range of service-level interventions, including an afternoon milkshake menu and a weekly morning tea with cakes provided by a local cafe. After the interventions have been in place for a quarter, the service reviews their service-level QI report and finds the prevalence of unplanned weight loss at their service has decreased by 20%. This data is presented to the Aged Care Provider Board, who decide, based on the positive outcomes, that they will introduce the dietary interventions in their 3 other residential aged care services. These reports will allow services to view their results for the current quarter, as well as compare them to previous quarters. They also report a percentage change in the data reported against each QI. Additionally, the reports will provide the service with year-to-date averages for each measure and provide national averages for this quarter and year-to-date. National aggregate de-identified quality indicator data for each quarter is published on the Australian Institute of Health and Welfare's Gen Aged Care Data website. The published QI data will include national, state and territory level, participation statistics across all providers and summary statistics for each QI. Data at the individual service level is not published. More information can be found on the Department's website on the National Aged Care Mandatory Quality Indicator Program page. For your convenience, we have listed some of the key QI resources. Congratulations on completing the Unplanned Weight Loss Quality Indicator Information module. You should now have an understanding of the objectives of the QI program, unplanned weight loss and some of the reasons why it may occur, the importance of monitoring unplanned weight loss, QI program requirements for classifying, collecting and recording information for the unplanned weight loss QI, QI reporting, including service level reports, and where to find further information about the QI program. When you are finished, you can close the session by closing your web browser.